Tock Seng Hospital will start admitting patients into Ward 9D from tomorrow. The ward was the centre of Singapore's first COVID-19 hospital cluster. Deborah Wong gives us a glimpse of Ward 9D, the first time media has been allowed in since the cluster emerged.
One cluster, 46 cases, and 2 weeks of lockdown. This is where it all began, Ward 9D. The COVID-19 task force is still investigating the cause of transmission. So far, no protocol breaches have been found. However, they're studying the possibility of issues with airflow and ventilation in the ward. And they're not ruling out other factors, such as if the spread could have come from unmasked patients and visitors. While the outcome is still inconclusive, the hospital has stepped up safety precautions. Inside this ward, what you see are new HEPA filters, high-efficiency air filters used to trap pollutants, as well as new exhaust fans. Together, they help to replace the air in the ward up to 12 times an hour.
Outside the ward, what we have here is a donning station. So nurses, before they enter the wards, they need to come to these cubicles to put on their personal protective equipment. Now, they were not required to do so previously. In fact, they were only required to wear surgical masks. And what happens after they exit the ward? Well, they have to come to the doffing station. Now, this is where nurses will have to dispose of their used equipment so as to do so in a very safe manner to prevent any form of cross-contamination.
The hospital has also stepped up its swabbing routine for staff and patients.
What gives us the confidence to reopen is the fact that we've been doing fairly regular testing in the inpatient setting in the last 3 weeks, and we have fortunately not found any new infected patients or new clusters of patients. Some of the later cases that have been reported in the last week or so are mainly patients who have already been isolated.
Still, it hasn't been easy, especially for staff in Ward 9D. They had to be quarantined to contain the spread.
I think initially I would say that there was an element of shock, but because we are all very tuned in with our protocol and processes, the staff were actually on quarantine. So we have been actually meeting them on daily Zoom calls to be able to check on them, as well as to give them an update of what's happening in the hospital and to identify anyone who's actually feeling maybe a bit more emotionally down, and then we'll be there to help and support them.
When I was away, it was during the Ramadan period, so I had to break fast on my own, but I managed to video call with my friends and my family members that actually occupy my loneliness.
For now, patients can only receive one visitor a day for 30 minutes. Those medically fit to wear surgical masks are required to do so.